Hey, thanks for joining us. I'm here with Dr. Dunlop. And Doctor, this is kind of ironic because I don't have my water bottle here, which I usually take a sip before getting started here. And we're talking about dry mouth. What is dry mouth and what does it do? And how can everybody there at Coshocton Dentistry help?
Well, it's an unfortunate thing. It's common, of course, as we get older too. But dry mouth it's called xerostomia, but it's just decreased salivary flow, and you need saliva. If you don't have saliva, you will have tooth decay. A lot of times, rampant tooth decay. So saliva is a very important thing. It just buffers the acidity of your mouth. So if you don't have that buffer, and your mouth is very acidic, everything breaks down pretty quickly. So there's lots of things that are on the market, over the counter, things that you can do. Obviously, if you're dehydrated, if one of the things they're finding is vitamin A deficiencies can cause it. Smoking, tobacco, those kinds of things can dry you out. And most commonly prescribed medications that we have today in our shelves, medicine cabinets, have a side effect of drying your mouth. So very common thing. What we offer normally is just counseling on more water in your diet. We need there's some salivary substitutes that are over the counter with biotin and xylitol, which is a sweetener that a lot of products have in it, will stimulate some salivary flow. Those are the things that you need to kind of keep yourself going. Avoiding caffeine and avoiding maybe alcohol mouthwashes or other things we'd recommend. Those things, alcohol mouthwashes especially, dry you out. So salivary flow and just the moisture in your mouth are important things. And if you're having issues, don't be afraid to talk to us about it.
And if somebody comes in, you ask them some questions to get a sense of, what do they drink? What's their activity level?
So most of the time we evaluate just clinically. You look at your mouth and we can tell instantly a lot of times, their salivary flow is just not normal. So that spawns those kinds of questions on, diet and those kinds of things. And obviously looking at their medical history and the meds that they're on, we can a lot of times pick out certain drugs that have that larger consideration, like antihistamines or, like I said, mouthwashes with alcohol. Those kinds of things can really cause some problems.
Listen, if you suffer from dry mouth yourself, you might want to see the doctor and stop in Coshocton Dentistry. They can help you get the old wet mouth back, and that just improves another way of improving your life. And that's what they do at Coshocton Dentistry. They give you good oral health and makes for a better and happier life. Dr. Dunlop, thank you so much for sharing.
All right, Randy. Thank you, buddy.